Hello everyone. Thank you all for tuning in and being here today. My name is Anthony Almojera. I am a lieutenant paramedic for the Fire Department of New York City, Emergency Medical Services Command. I am also the Vice President of the FDNY EMS Officers Union, Local 3621. As you are all very aware, today we are here for a momentous event. We are here today to demand that this country recognize essential medical workers in a way that is real, tangible, and long overdue. Beyond the empty slogans of calling us heroes and throwing up a sign in a front yard and offering us a free beverage at a participating coffee chain, we are here today to articulate our demand in clear and no uncertain terms. You know what I'm going to say. We want equal pay and benefits, and we want it now. Equal pay to our fellows in other frontline services, and equal benefits of all those across the medical community spectrum. Am I out of line here? Should I just go slink away and take the crumbs that are offered? What do you say?
Woo!
Hey, you know I've been working EMS for nearly 20 years. 20 years in New York City. 20 years ago, I started out going to EMS school and living out of my car because I couldn't afford rent. 20 years ago, the Twin Towers were rubble, so the focus was elsewhere. But I joined and believed and persevered. So in those years, I have been in your homes and your workplaces. And I have seen the vicious impact of not having access to health care has had on everyday families. Oftentimes in EMS, we become the primary healthcare providers due to our fellow citizens' lack of healthcare insurance or access to decent, qualified medical facilities. And over the past 24 months, the medical reality, this incredible inequality, has only gotten worse. As we all know these last 2 years, well, you tell me in these last 2 years, what's happened to you, and what do you know, and who do you know that's been hurt, devastated, and bankrupt? Yeah, that's what I'm saying. I'll tell you this, going into the pandemic, EMS wasn't the service that New York City deserves. Do you know that very few members stay in the service for more than 5 years? New EMS workers can't make a living on $35,000 a year in New York. I'll tell you, the benefits offered are worse. So we've become a corps of novices, well-intentioned, but sometimes acting well out of our scope of expertise. In the height of the coronavirus crisis, I had emergency medical technicians with 6 months experience running an ambulance with kids who were fresh out of the academy. They coped incredibly well, but it wasn't fair to them. They'd stumble and falter, ask questions, and stare into space, wait for an experienced tech to take over. And we did, and they did, and they got better, but it's not how you run a world-class emergency medical service. For myself, I didn't weather the pandemic so hot. I thought I could handle anything my job threw at me, that I could witness any amount of suffering. I thought I was that someone who people could lean on. After all, I was the senior paramedic who could restart a person's heart or detect a rare aneurysm and save a guy from drowning in his own blood. I was the union vice president and blasted the higher-ups on Twitter and butted heads with them in person to defend my co-workers' rights. I was the guy who cooked a 9-course meal for his friends at Christmas and organized group vacations to Hong Kong and Dublin and Uganda. I thought I had all the right moves codified and memorized. But I thought wrong. Yeah, you know. Because when the virus hit in the spring of 2020, I was already emotionally drained and disillusioned and disintegrating. My body was taking a toll. I had been worn out by my job and the frustrations of fighting for better pay and benefits. I had an arm injury incurred from carrying my now dead lieutenant out of his home. An event that shook me to the core as I saw my future laid out in front of me and his helplessness and fear. The injury meant I couldn't carry anything heavy, and a job with lifting dead weight was routine. I was contained to light duty, chained to a desk, a computer, and a dispatcher's radio. So I packed on the pounds and churned with unspent energy as COVID raged. Normally in New York City EMS, we normally handle 35,000 to 4,000 calls a day. A nice number, right? Well, I'll tell you this. In the 5 boroughs during the height of the pandemic, we were handling 6,500 to 7,000 911 calls a day. Cardiac arrest patients, normally in the 60 to 80 a day range, shot up to over 400 a day. You know, we in the unions have told our city governments for years that EMS was critically understaffed, woefully underfunded, and completely mismanaged. That we were lucky to continually just get by with what we had, and that if the big one ever hits, the proverbial chickens would come home to roost. Well, what happened? During early March, we started to bang out that drum even louder. Where were the PPE kits? What were our contingency plans? Where was the energy and the compassion New Yorkers had after 9/11? Now we were meeting up with COVID-19. As we soon came to find out, there was none. We watched in horror as the call volume shot up, and we were unable to keep up. I watched in horror as we responded heroically in spite of the odds, but eventually we could not keep up. Calls went holding for hours. Hospitals couldn't handle all the patients we brought in. They started to use our stretchers to perform patient care. Keeping the worst afflicted strapped down, they were attached to ventilators as the medics watched helplessly and unable to go back and respond to more 911 calls. And so eventually we started to get sick. At one time, over a quarter of our workforce of about 4,000 was out sick. There were days I'd respond to 12 to 13 cardiac arrests. I personally saw more people die in those first few months than in the last 5 years of my career. And as we got sicker, then we started to die. As of today, 16 of us have passed away due to COVID. And we also have endured 4 suicides. This job extracts a heavy toll in normal times. But the pandemic left us empty and lost. Like newly graduated EMS cadets, we were looking around for the experienced and confident to save us from ourselves and our weaknesses. But we were all afflicted, and we were all in it together. We still have too many members out there who will be unable to come back to work due to COVID. We have had members who had to leave and take care of sick family members, then who lost their jobs, and then lost their health insurance. They had to choose between buying food and being able to see a doctor. This is the reality of our world. During a global-wide pandemic, people actually lost their medical insurance. In my job, if we come off payroll, we lose our insurance. The choices were literally life and death for us and our families. As emergency medical service personnel, we know from life and death. This is our business. And yet things happen so fast to all of us. The pandemic highlighted something that we in the medical community have known for years. We need what the rest of the world has. We need recognition and care and respect, and we need it now. For far too long, we have accepted a pitiable status quo and watched our loved ones suffer. So we are here today because we are you. We live and work in the same communities you do. We are your neighbors, your wives and husbands, your children. We are your nurses, your doctors, your EMTs and paramedics. And if you are healthy, then we are healthy. But don't we all deserve a country where those who take care of us are taken care of properly? Don't we all get to enjoy the great bounty of this country? The old adage of united we stand and divided we fall has never been truer. I began this speech by stating as a medic, I go into your homes and see how you really live. I have seen many who just get by and survive. At the end of my career, I want to see something different. Equal pay and rights along with universal health care is just the start, but it's got to happen. And it's got to happen now, And we got to make it happen. We are the change we have been waiting for. And I'm going to fight for it. Are you? Yeah, I'm with you. Thank you all for attending. I wish you all peace.